Please join us for a conversation on COVID-19, youth, and mental health.
Greetings from the St. Paul Baptist Church Mental Health Referral Ministry. My name is Sherry Davis, and I am the co-chair of the Mental Health Referral Ministry. Our ministry offers information and references to our St. Paul family in the area of mental health awareness. Today, we would like to discuss in detail the effects of the COVID-19 pandemic and the impact that it has on our lives, adults as well as children. The impact of sheltering in place, not going to school, not being able to be physically social, especially for teens, and wearing protective masks can be very scary for our children and teenagers. Children and teens have been catapulted into distance learning and missing out on milestone activities that define their school experiences. All of these examples have grave effects on our young people, and we would like to hear from Rhonda Love on the impact and effects of these changes on our children and teenagers. Rhonda, welcome.
Thank you, Sherry. Earlier I talked about the impact on the adults, and what I wanted to focus on and did at that time is the operation of the brain and how information comes into our system and how we process that. So for children, no matter the age, their brains and bodies are even more vulnerable to the harmful effects of stress than adults. And most often, they aren't able to recognize or verbalize it. Stress in children may show up differently than stress in adults. Kids are wired to be tuned in to the emotional signals that are given from their parents, from their caregivers. So our kids pick up on our energy, especially now when we are all home together. As we address the process of encoding with adults, the same occur with children. This process will be different depending on the developmental age of the child. We need to be mindful of their limited mapping based on the age and lack of experience with traumatic events as such. Babies may begin to experience differences in their sleeping and eating patterns when they're under stress. Toddlers and preschoolers may go back on developmental milestones they have already achieved, like sleeping through the night or bedwetting. In the school-age children, their physical and emotional responses will be different than teenagers. The school-age children may appear a bit more irritable. They may be what I perceive to be bouncing off the wall, expressing boredom, having a hard time managing their impulses, paying attention, or focusing. They may report some physical ailments, such as headaches, tummy aches, difficulty sleeping, or worsening health issues like asthma, eczema, or more frequent infections. With teenagers, though, on the other hand, we may see a slight difference. Teenagers may show it in a way of being withdrawn. Certainly, they will express being bored. They may also increase risk-taking behavior. They may lead to harmful acts against themselves and others. The teenagers, as with children, may also experience physical ailments from their experience with stress. They may experience headaches, stomach aches, difficulty sleeping, or worsening health issues like asthma, eczema, or more frequent infections. With the children, though, with management tools, it's important to understand that they're needing and depending on the caregiver, the parents, to help them through that. They don't have the experience that they need, to develop plans and to carry those plans out in terms of self-soothing or calming themselves in a time like this. Please remember that the most important ingredient for healthy children is a healthy caregiver. And I've read in some of the material that I had reviewed, which was a really nice example, and one we hear often on when those who have ever flown on a plane. It says, please remember to put your own oxygen mask on first so that you can be available for your children. So with that said, it's very important that parents, that we are healthy, that we are properly dealing with our own stress in order to be able to handle our children. If we are at a heightened level of stress, heightened level of anxiety, or in a depression, it is difficult for us to provide any type of assistance to our children or to anyone else. In working with our children, the first step I like to address is talking about what's going on. And this can be very challenging. Keeping in mind that we're looking at a variety of age differencing when we're addressing our children. But no matter the age of the child, uncertainty can create anxiety. It is important to talk to your child about emergency situations in an appropriate language. Also, it's important that you are calm in your approach and sensitive in the ways to help them cope. We want to start the conversation by asking them what they know about the virus, then ask them of their own fears and their concerns. Ask if they have any questions. Take the time to correct misinformation and share honest facts in accordance to age appropriateness. It is important to include the things they can actively do in helping out their situation, such as proper hand washing, covering coughs and sneezes, disinfecting surfaces, and physical distancing, and wearing a mask when outside and around others for essential reasons. One area that may be most difficult in helping them understand why they can't help, one area that may be most difficult is helping them to understand why they cannot see their grandma, they cannot see their auntie and their uncles. They cannot go over and play with their cousins. And that piece is really difficult because for children, they don't understand. They think it's a punishment. Why can't I go and play with my friends? Why can't I go and see my family? So that area, I understand, is difficult, but it has to be a conversation had with your children. We can empower them by helping them understand that their actions are actually helping their grandparents, helping their aunts and their uncles and their cousins, so they won't be sick or get sick. And then also, so they themselves won't get the virus, and then later on won't be able to play with them because then they're sick. So I think if we can relate it in a way that we can empower them that, to understand that their acts that they take are actually helping in this situation, and that the decisions they make are going to be helpful all the way around. We want to keep our children connected with their networks. We have a number of mediums available to us to remain in contact with those who are significant in our lives. If possible, encourage video chats with family members so that they can see their grandparents, see the aunt, see the uncle, their friends, and know that they are okay. A number of school-aged children have the advantage to engage in virtual classrooms where they are able to see their teachers and other students. It is a healthy reminder for the families to not isolate, and also that everyone else is not doing the same. So in essence, we want to not isolate. And as the children are interacting by these mediums, they're seeing that everyone else are doing the right thing and they're not isolating as well. Because one of the concerns that children have is that they have a sense to feel bad for someone else. If they're home and they're only playing with their toys all by themselves, then that means someone else is sad in their home and playing with their toys all by themselves. And so to have some type of a video contact and being able to see into someone else's home and see their face and see them playing and they're happy while they're playing, is very helpful for the children. They need to understand that they're not missing out, that this is something that's affecting everyone. They're not the only ones that are in their rooms. They're not the only ones that are at home and not at the playground or not at the park. We also want to build a routine for the family, and especially for the children. In times of uncertainty, it is especially important to stick with normal routines. Predictability and structure helps children self-regulate. If possible, include the children in the weekly and daily scheduling. It helps to reduce anxiety, fear of boredom, and reduces the challenges of behavior as you move through the day. With older children, the teenagers, it provides a sense of control and self-determination. All of these suggestions for adults that I've addressed previously in creating a stress reduction list can also be utilized when developing a daily routine for the family. And some of those things can be incorporated, such as the supportive relationship we just talked about, but also exercising. It is important that, especially for children, that they have a place, a space where they can move about, where they can exercise, and they can play. It's important to have a healthy sleep pattern, especially for our children, because again, as adults, we can get lost in time, so can our children. It's important that they have healthy nutrition. Also important that they have access to mental health and behavioral health support. They also can engage in activities of mindfulness, like meditation and prayer. We want to make sure also that in that routine, we are working with our children to be consistent in their hygiene practices. I don't know in your household, but when my children were young, summer in their mind seems to be the time that you don't have to bathe, and you don't have to change clothes, or you don't have to brush your teeth. But we want to make sure that our children understand, because there needs to be consistency in hygiene practices, that each day is a purposeful day, and that they're getting up because they have something to do. Although they may not leave the home, but they are engaged in an activity. The schools now, as they're ending, they still have homework packets for some children. And so if to have that structured into that day is going to be helpful. Just as you will be preparing for school, you do the same, although you're not leaving the home. So we want to make sure that they continue those practices. It is important to remember, again, I go back to the essence of play. Play is an essential part of a child's daily activity. The opportunity for exercise, creativity, and play are critical for behavior, learning, and development throughout the day. And lastly, we need to keep the routine. It's important in homes, just as the structure of the school and the structure of your home without the COVID virus. There's a structure. We get up at a certain time, we go to bed at a certain time, and everyone have duties that they need to carry out. So you want to start your schedule and keep it as a routine. You want to watch for those things that are working and those things that do not. Make the adjustments as needed. Check in with your children regularly and evaluate how well they are doing. Get their feedback in terms of how well the plan is working. That is essential because then, although you have a plan, you may find yourself in those moments of void where now they're bored again. So it's important to keep them part of that scheduling and also to check in with them to ensure that your schedule is effective. Then also we want to reach out for mental health services when needed. I want to make sure I give information about mental health services if that is a need. I have some numbers I'd like to share, and one is the Sacramento Mental Health Crisis Line 24 hours. That number is 888-881-4881. Mental Health Services, area code 916-854-8897. And you can also contact the church here at St. Paul Missionary Baptist Church, where we have resources where we can get you connected to the sources that you need to get your needs met. And that number is area code 916-737-7070.
We would like to thank Rhonda Love for sharing with us today. Thank you, Rhonda. We pray that this has been helpful. Stay safe, well, and be blessed.
The following mental health resources are available to you. The Sacramento Mental Health Crisis Line by contacting 888-881-4881. Mental Health Services at 916-854-8897. And St. Paul Baptist Church at 916-737-7070. Thank you and have a blessed day.